you know?
So, what would you like women to know, especially moms that are in the position of deciding, should I put my daughter on birth control
Mm,
because the girl, they're
yeah.
suffering, they are in pain. And as women, at least we understand your pain is real and I've been there and they want that pain to stop. What do you want them to understand about the difference between managing symptoms versus actually getting to the root cause?
And I love that you brought up the moms particularly because as our generation is getting to that point, we want to be very mindful and protect our daughters. And I would say, okay, specifically for period pain. So, not talking about sexual activity, that's a whole different thing. Specifically for period pain, really teach your daughter how to advocate for herself and understand her body. And so learning, what's going on instead of just saying, "Oh, I have period pain," saying, "Okay, how much caffeine are you drinking? How much inflammation are we taking on? What does the diet look like? What does your social environment look like? What are all of these
Mm,
pieces that are contributing?" Instead of rushing to fix it. And a lot of times when we talk about the difference between symptoms and causes, I like to use something like a sandwich approach with clients of saying, "Okay, I'm not going to make you suffer while we address these foundations because they are more slow moving and your body does take time to heal. And if you've been living, out of alignment in all of these things that are causing inflammation and pain and whatever and imbalance, it takes time to rectify that. In the meantime, what can we do for symptom management and kind of sandwich the issue in between? So we have the foundations coming up and we have, that acute management on top. And so there are things other than hormonal birth control that we can use to manage in the meantime.
mhm. And so, what would you say to one of these moms again that are deciding to put their daughters on it? Is it actually solving the problem or is it
Mm.
masking the problem and allowing stuff to just keep on brewing in the background unaddressed?
Yeah, it's not solving the problem. It's solving the problem in the sense of it's giving you some relief from the immediate issue, but you're trading that for issues down the line because it's not actually fixing whatever the imbalance is. It's suppressing your ovulation and it's trying to suppress your entire hormonal, like your natural cycle. And that's why you're not having a period. That's why the hormonal birth control works the way it does. But when you're suppressing ovulation, it's called the fifth vital sign. A lot of times, there's actually a book by that name, which I would recommend to listeners because it's a wonderful intro into how to track your cycle, all the things you need to understand. But when we think that just because you can't see the symptoms anymore, the problem has gone away, I think that's very short sighted. And so, obviously, some of us don't have the knowledge, the skills, the access to a practitioner, whatever. And so you think hormonal birth control is the best option.